Good morning. I'm Ann Tam Piazza, and I'm the Executive Director of the Oregon Nurses Association. Today, we stand united on behalf of the thousands of nurses who are the lifeblood of our healthcare system. Frontline nurses from 7 Providence hospitals across Oregon have spoken loudly and clearly. Providence's latest offers are simply not good enough. They do not go far enough to address the systemic issues that have plagued these hospitals for years, putting both caregivers and our patients at risk. With an historic 92% turnout across all 7 bargaining units, ONA members overwhelmingly rejected Providence's offer, with 83% of those voting casting a resounding no. These numbers are not just statistics. They represent the collective voice of thousands of our members who have been unwavering in their dedication to delivering the best possible care to their patients, even working in untenable conditions. From Providence St. Vincent, Providence Portland, Providence Milwaukee, and Providence Willamette Falls, to Providence Newburgh, Providence Hood River, and Providence Seaside, ONA nurses have made their positions clear. And as we await the results of our colleagues at Providence Medford and the hospitalists at St. Vincent, the message to Providence is loud and unequivocal. Our members will not settle for less than what is a fair contract and one that they deserve. Our bargaining teams approached these negotiations with a commitment to get Providence to put their best offer on the table to end the strike. Providence claimed this was the best they can do, and the bargaining teams sent this contract to be voted on by our members. It is clear that this agreement was not good enough. Our members have now made their voices heard with clarity, conviction, and courage. ONA members are demanding what would be fundamental in any healthcare system. Number 1, safe staffing, to ensure that the level of care our patients receive reflects their need, with the statutory ratios as a minimum standard, not the only standard. Number 2, competitive wages, to recruit and retain the staff that is necessary to achieve safe staffing levels. And number 3, affordable healthcare plans, because our caregivers should be able to care for themselves and their families too. Nurses know Providence can and must do better. And until Providence is ready to negotiate a contract that addresses these critical systemic issues, ONA nurses are committed to standing strong. This is not a fight for minor adjustments or temporary fixes. This is about building a better, safer, and more sustainable healthcare system for all of us. And today, ONA is calling on Providence to return to the table and give us a fair contract, one that reflects the incredible value and sacrifices that our nurses bring to our patients and our communities every single day. In a moment, you'll hear from our leaders on why these offers were rejected and the urgent need to address our key priorities. And first, I'd like to introduce Richard Botterill, who is the chair of our Providence Portland bargaining team. And Richard has been a tireless advocate and leader. Thank you, Richard, for your commitment, dedication, and always fighting for our nurses and our patients.
Hi everyone. As Ann said, my name is Richard Botterill. I'm an emergency department RN at Providence Portland Medical Center, a proud ONA member and the chair of our bargaining unit. Thank you all for being here today. Yesterday's vote to reject the tentative agreement was a clear message to Providence. Nurses care about patient staffing and are incensed about the increased workloads and cuts to support staff to the detriment of our patients. You, the members of the communities we serve and care for. We are not accepting the status quo anymore. One of the main issues of our contract fights, this strike, and something that has plagued Providence hospitals for years is unsafe staffing. Staffing levels at Providence have been inadequate and unacceptable for a long time now. In some cases, staffing has been dangerously low, putting caregivers and patients at risk. When Oregonians come into our care, they expect and deserve to have enough time with us and their other caregivers. Unfortunately, at Providence, we are often understaffed, which forces us to spend less time with patients and leads to nurse burnout, causing high turnover rates. Understaffed hospitals have become the norm at Providence, but this is not the status quo that Oregonians should accept. Chronic understaffing is caused by a few things. First, if Providence continues to lowball us on wages and benefits that are way behind other hospitals, it will be impossible for them to recruit and retain good nurses to get their staffing we need to support our patients. Providence has chronically been behind other health systems, and even after their latest offer, we would still make less than our counterparts at other hospitals. It's not complicated. If you don't offer competitive wages and benefits that are fair, nurses will find jobs at other health systems where it's easier to support a family. Second, the passage of Oregon's landmark safe staffing law in 2023 provided a safety net for nurses and patients by setting a maximum number of patients a nurse and nurse assistant can care for. Providence has pressured nurses to accept maximum patient assignments without incorporation of criteria into the nurse staffing plans for adjustments if a patient is very ill or acute. They have ignored the ratio for nurse assistants, undermining the team relied upon to provide care. Nurses know that this is not safe and have refused to allow Providence to undermine the intent of the law. Our nurses have worked under the strain of frequent understaffing since Providence began implementing their interpretation of the law by increasing workloads while decreasing support staff. Providence nurses are standing up for you and your families against corporate greed. We know we can do better as we place patients before profits. Providence has racked up violation after violation since the law was implemented. Providence has been so bad on staffing, there have been more than 300 staffing complaints filed against them since the law was implemented in July of 2024. Most recently, the Oregon Health Authority found multiple staffing violations at Providence Seaside and Providence Portland. Providence recently stated in a communication to staff that Providence ministries are complying with Oregon's staffing law. We will not agree to additional contract requirements that differ from the law. However, OHA's repeated findings of violations of Oregon's safe staffing law tell a very different story, one of a systemic and dangerous pattern of failing to follow even the most basic legal requirements. One of the most recent examples was at my hospital, Providence Portland. The Oregon Health Authority found that my hospital repeatedly failed to adopt legally required nurse staffing plans for critical units, including the neonatal intensive care unit, critical care, medical oncology, surgical oncology, and labor and delivery. And just this morning, we were informed of 2 more violations in surgical oncology by OHA. I believe you guys have copies. This means that, according to nurses on those units and the hospital staffing committee, those units are not staffed appropriate for safe and therapeutic patient care. This systemic failure has left caregivers without the necessary staffing guidelines to provide that safe and effective care for you. While there was some language in this contract that would codify aspects of the 2023 landmark safe staffing law and protect our hospitals from Providence's illegal failures, that language did not go far enough. Providence did not address patient acuity, the amount of care a patient needs based on the severity of their illness, in establishing safe staffing standards. Simply put, there is a huge difference in the amount of care from patient to patient, and frontline nurses want the ability to provide the amount of care every patient deserves. Our contracts and our staffing plan should reflect the amount of time that nurses should spend with certain patients. O&A members want safe staffing protections. Oregonians who come into our care deserve safe staffing levels, and Providence must address safe staffing in the most robust way possible, or O&A members will continue to reject these tentative agreements. Nurses can only deliver the excellent care that we expect of ourselves and that our patients deserve if we have safe staffing protections in our hospitals and in our contracts. Providence has shown time and time again that the law isn't enough. Nurses want the protection in our contracts too. Thank you. Now please welcome my friend and colleague, Kathy Keene from Providence St. Vincent.
Thank you, Richard. Good morning. My name is Kathy. Good morning, everyone, and thank you for being here. My name is Kathy Keene, and I'm a proud cardiac nurse and chair of the Nurses Bargaining Unit at Providence St. Vincent. I've been a nurse here for over 25 years, and like so many of my colleagues, I've dedicated my career to caring for this community. Today, I'm speaking on behalf of the incredible nurses who are the backbone of patient care, not just at St. Vincent's, but also at every other hospital where nurses are facing the same challenges. I want to talk about an issue that is deeply important to us, and it's one that I know can be complicated for the general public to fully understand. So I want to be very clear about why Providence's approach to retropay and bonuses is unacceptable, and why this issue cuts to the heart of respect for the nurses who care for the community every single day. Here's the reality. Nurses at Providence St. Vincent, as well as Willamette Falls and Newburgh, have been working without a contract for over a year. That means no raises, no cost of living increases for over a year, despite inflation making everything from groceries to rent more expensive, and no back pay to account for that delay. These delays are not accidental. They are a deliberate tactic on Providence's part, and those delays have consequences. Let me give you some numbers to make this clear. Providence owes nurses back pay. They have the resources to pay what is owed, yet they refuse. Instead, they've dangled the idea of a ratification bonus, a bonus in lieu of retroactive pay, and those bonuses in the tentative agreements we just resoundingly voted down fall far, far short of what nurses deserve. You're going to hear them say that some nurses could receive up to $10,000 as a bonus, for example, and those claims are, quite frankly, misleading. The vast majority of nurses will never qualify for a bonus that high under Providence's latest contract. If they did qualify for $10,000, it would be because they were really owed $20,000. Those bonuses don't get close to what many nurses have lost in pay increases while working without a contract. Providence's so-called bonuses are like putting a bow on an empty box and calling it a gift. Imagine working all year and being owed, let's say, a $5 raise for every hour you worked. That's the money you've earned. That's your money. But instead of giving you the raise you deserve or that you would have earned, your employer turns around and hands you a one-time check for $100 and says, "Aren't you happy now?" That's not a gift. It's a cheap substitute that doesn't come close to what's fair, and it doesn't respect the hard work that went into earning every penny of that retro pay. For perspective, Providence spends more in 1 week on strike replacement nurses than the total gap between what was in their last offer and full retro pay. Let me repeat that. Providence will spend more on replacement nurses next week than the total amount of money they would need to put on the table to pay full retro to their own nurses. They have the money. And let me repeat that, they have the money. It would take less than 0.2% of their $7.8 billion cash reserves to close the gap. And that would still leave them with well over $7 billion still in reserves. Or, for example, Providence could consider reducing their executive bonuses and incentive pay to find the money. In 2023, for example, Providence paid over $70 million in bonuses and incentives compensation to their executives. What if they agreed to reduce those bonuses by 35 or 40%? How about Providence executives give up their bonuses and give that money to the nurses who actually provide patient care? But I also want to be 100% crystal clear. This is about more than money. It's about respect. Nurses here at Providence hospitals have carried this community through a pandemic. We've worked short-staffed. We've sacrificed time with our families. And yet, instead of acknowledging our worth, Providence treats us like an expense they'd rather not pay. Retropay isn't a bonus. It's what's owed to nurses for the work we've already done. It's a matter of fairness. It's a matter of respect. And it's time for Providence to stop dragging their feet and start giving the nurses the respect they've earned by giving us the pay that we've earned. Thank you. And now it is my pleasure to introduce my colleague and a true champion for nurses, healthcare workers, and patients, Virginia Smith from Providence, Willamette Falls.
Hi everyone, good morning and thank you for being here. As Kathy said, my name is Virginia Smith. I've been a nurse at Providence, Willamette Falls for 17 years. I am the bargaining unit chair. I have also been the staffing committee co-chair for quite a long time as well. So I live just a few minutes away from one of the largest hospitals in Portland where I could go work tomorrow for a better wage. But I choose to work at Providence, Willamette Falls because I always wanted to work at a community hospital, and I care deeply, as all of our nurses do, about our communities. Today, I want to address two critical failures in Providence's latest contract proposals, failures that have directly contributed to nurses overwhelmingly rejecting these agreements: compensation and health insurance. First, I'll go through compensation. So the reality is simple. When nurses can find jobs at other hospitals in Oregon that pay more and provide better benefits, they will take those jobs. Nurses have families to support, bills to pay, and their own health and well-being to consider. If Providence wants to recruit and retain the highly skilled nurses our communities rely on, they have to offer compensation that is competitive with other health systems. But what we saw in Providence's latest offer fell short. Even with the proposed raises included in these tentative agreements, Providence nurses would still end up earning 15 to 20% less than their counterparts at other major health systems in the region. Starting nurses at Providence often make several dollars per hour less than nurses at Legacy, Kaiser, or OHSU, putting Providence at the bottom of the pay scale among large Oregon health systems. Without competitive wages, Providence is effectively training new nurses only to see them leave for hospitals that offer better pay and benefits. So this stagnation in pay is a direct contributor to high turnover, with many nurses opting for better paying positions at nearby hospitals. Other health systems are also offering much better health insurance in terms of both coverage and cost, leaving frontline nurses with really no reason to stay at Providence. It's not just bad business, it's also unsustainable. This failure to provide competitive wages sets the stage for a mass exodus of experienced nurses who can simply drive up the street to OHSU, Asante, Kaiser, or leave Seaside or Hood River communities and move to Portland to work at Legacy, leaving patients to suffer the consequences of understaffed hospitals and burnout nurses. Providence wants the public and our nurses to believe that their last offer is the best that they can do. It's simply not true. This is a $29 billion corporation that paid 164 executives $177 million in salaries in 2023 alone. Their CEO alone made $14.8 million last year, or 2023. Providence says these salaries are necessary to stay competitive with other hospital systems. But what about staying competitive for the nurses who are actually delivering the care? When asked about paying nurses competitive wages, they said it was financially unsustainable. Providence knows how to pay top dollar to their executives, but they're refusing to do the same for their nurses on the front lines. When we have explained how our reasonable proposals are to keep them competitive, they have said that they have no intention of being top of market, which has left us wondering why they don't feel they need to invest in their nurses or the health of our communities. It is corporate healthcare hypocrisy, and it is unacceptable. Now I'll walk through our health insurance. So when Providence forced nurses onto our new health plan with Aetna, while refusing to negotiate that switch, they promised us that nothing would change. That promise has been broken from day one. Nurses have seen their providers go out of network, services denied, and out-of-pocket costs skyrocket. For many, this has amounted to an unspoken cut in pay. Nurses have had their therapies and treatments disrupted, delayed, and in some cases canceled altogether. These required and time-sensitive treatments, such as chemo and other medications, and therapeutic relationships, especially specialties that are hard to establish for children, cannot be fixed quickly or easily replicated. This is a total and complete failure of Providence to take care of those of us who take care of Oregonians. Providence has had the opportunity to fix these issues in negotiations, but they have failed to act. Nurses have been left with fewer options for care, higher costs, and constant roadblocks to accessing the services they need. This is not what we were promised, and it is not what we deserve. At the end of the day, Providence is making choices. Choices to prioritize multi-million-dollar executive salaries over pay that's fair for nurses. Choices to invest in profits over providing employees with quality health insurance. These choices are driving nurses away, putting our patients at risk, and unfortunately showing us exactly where Providence's priorities lie. So the nurses at Providence have made our own choices. We made the choice to reject these agreements because they do not value nurses and they do not value patients. Providence can do better, and if they want this strike to end, they must do better. We are not going to stop fighting until they do. Thank you. Ann.
In closing, I want to thank our patients and communities who have stood with us. I want to thank all of our member leaders here today, and I want to thank each and every one of our members on the picket line and maybe joining this virtually who have made your voices heard. You are inspiring to me, to caregivers across the state and this nation. And let me be abundantly clear. O&A is ready to negotiate at any time. Providence, the ball is in your court. Come back to the table immediately. Our nurses are ready to have serious discussions the moment that you are prepared to do the same. And until then, our members will continue to strike at all 7 facilities. We will not back down because we know what's at stake for our patients, for our profession, and the future of our healthcare system here in Oregon. We're also calling to continue the support from our communities to stand with us in this fight. To the patients and the families who have firsthand witnessed the extraordinary care that our members provide, your voices do matter. You can tell Providence that you, as patients, are ready for them to take their nurses seriously and prioritize the people who care for you and for your loved ones. Community members can also show your support by contributing to our strike fund, which encourages our nurses to continue to stand and support and continue to fight this fight. Please visit OregonRN.org/patients before patient. Say that again. Please visit OregonRN.org/patients before profits to make a donation and help us keep this vital fight. Together, we are sending a powerful message. It is time for Providence to stop with excuses and start addressing the real systemic issues that our nurses and our patients have faced for far too long. Thank you for standing up for Oregon's nurses. Together, we will win a fair contract that our patients need and our nurses deserve. Thank you.